We're going to start off with Dr. Dmytro here today. And I'm going to tell you a little bit about him before I bring him up on the stage. Dr. Dmytro completed a medical degree and postgraduate specialization in general surgery. He was trained in minimally invasive surgery and surgical endoscopy and engaged in a medical clinical research that resulted in a PhD degree in surgery. At the present, Dr. Dmytro has entirely dedicated his professional career to advocating wellness and healthy lifestyle. He is the head of the Medical Advisory Board of Stellar Biomolecular Research in Germany and the Chief Medical Director of European Wellness Centers International Group. Today he is going to be presenting cell therapy as the main stratagem of biological regenerative medicine. Please welcome Dr. Dmytro.
Thank you. Thank you very much, and very good afternoon, and good morning, good evening to all the people who are watching us in the different time zones. It's a great pleasure and a great honor to be here, ladies and gentlemen. And yesterday was extremely, very exciting moment, and I even couldn't fall asleep, after that half night, and sort of felt like, very energized and pumped up. And but today feeling great, absolutely feeling great. And it is absolutely great and fantastic to be among people and to speak in front of people whom I do not have to ask a question whether you want to live 100 or 120 years. Yeah? And I also don't have to ask you a question whether you want to feel the same way how you feel now, or even better when you're 100, 120, or 130 years. Yeah, that goes without doubt, absolutely. And the only question that we have to solve here is how to do it. Okay, so that's the only thing that we have to figure out. And believe me, we are not really being original in pursuing this idea, because even more than 2,000 years old. Even the ancient Greek doctor Hippocrates, he said that the nature has a healing power. Okay, and he believed, and it was like 4th or 5th century BC, and he believed that, and he built his entire practice on understanding that there is an aging and the development of the disease. It all happens when there is an imbalance between the healing powers, and whatever the detrimental forces, that influence our health in a not really a good way. And then Romans, they even had that particular phrase, that word, which the sentence that said that senectus ipsum morbus est. It means that age itself is a disease. And if you're familiar with the Cicero, he's a very famous Roman philosopher, he said that we have to fight against aging as we do against the disease. So 2,000 years ago, people already had sort of the hints of understanding, that aging is not good, and that there's a lot of diseases which come along together with aging. And people try to find out the ways how you can actually postpone and maybe reverse that, and they tried a healthy lifestyle and probably different whatever treatment strategies they had those days. And the great thing is that the science was evolving, our civilization was evolving for 2,000 years, and now we have a much, much better understanding why it happens, why we actually age, and we have a much better understanding of the mechanisms how to reverse aging. And I would like to bring the quote of Cynthia Kenyon, she's a wonderful scientist, one of my favorite scientists, and she said that age itself is the largest risk factor for a huge number of age-related diseases. And when we talk about age-related diseases, we can start with diabetes type 2, osteoarthritis, cataract, ischemic heart disease, chronic liver disease, chronic kidney disease, osteoarthritis, depression, neurodegenerative diseases, Alzheimer's and Parkinson, and so on and so on and so on. So the list is actually huge. So if we understand in principle that we can keep things repaired, we can actually keep on repairing them practically forever. So it's just a question of us finding what are the actual ways and mechanisms how to do it. And Also, along with that, we have understood that there are ways how to reverse the aging of the mammalian cell, and it's mostly the genetic factors, the dietary factors, it's what you eat, so if you avoid certain harmful substances like sugar, carbohydrates, and I mean, not just avoid eating cakes, completely eliminate that from your food, from your meal, because biologically, we have mechanisms how we can create carbohydrates. It's called the glyconeogenesis, so we can actually create it in our body from the fats and the proteins, and also we don't have to overconsume those substances, which will create the chronic systemic inflammation, ongoing. And then we have the pharmacological approach, and we have the biological and biotechnological approach, and that's mostly what I am going to talk here about. And what we also have globally, happening all over the world, in all countries, is that we are a tremendously aging population. Okay, we are an aging civilization. Never yet in the history of our civilization we lived, on average, our lifespan was so long as we have it now. If you look at the statistical analysis from United Nations, it says that from the year 2015 until year 2050, they are projecting about a triple increase and triple-fold the number of people who are older than 85 years old. In less than 50 years, we're going to triple that amount of people. And 65, if say 30, 40 years ago, 65 or 70 years old was the age that people said, oh wow, you're lucky that you live that long. It's not a problem, to live as long, 65 and 70 now, so that's not a problem to live long. Conventional medicine sort of solved this problem and helped us to live longer. But the problem is that it's not just to live long, it's to live good, okay, to live a good life and to live a healthy life. And unfortunately, at this particular moment, conventional medicine does not give us those effective solutions how we can actually live long and live well. Unfortunately. And that's where the researchers and holistic doctors or alternative doctors, although I don't really like these sort of tags, and people say that I'm an alternative doctor. I'm not the alternative doctor. Actually, I've built my career and my practice on scientific facts, on scientific data and absolutely valid research, So I believe that if we pay more attention to that, we can actually help people to live better, not only live longer. And along with this, by the way, increased lifespan, we have another problem that comes along, and that problem is a huge number of various age-related diseases. Now, statistically, and I looked into the statistics of United States, especially before coming and talking here, 62% of all Americans who are older than 60 years old have at least 2 or more chronic age-related diseases. And this is far not the complete list of the chronic age-related diseases that at least 62% of Americans in the age of 60 and above have, okay? And cardiovascular disease, we all know that it's a number one risk factor, it's number one cause of death, And then even such things as depression. Don't think that the depression is just a small thing that you just feel down, and things like that. No, the clinical depression nowadays, it affects about 15% of the global population. And in another about 10, 15 years, it's going to be the second cause of death, okay, in the world, because it really causes a lot of, if you heard of the psychosomatic, such term, so it's not just our psyche, it's actually it's neurophysiology, and the neurophysiology, it runs and governs, our entire physiology, So if you are depressed, if your central nervous system does not work properly, it will cause horrible detrimental damage, to our entire body. And I want to introduce this iceberg analogy to you. And all those diseases, the age-related disorders, they are just here. They're on the top of the iceberg, okay? And unfortunately, conventional medicine, what it's doing now, it's addressing only this visible part of the iceberg. So the approach that conventional medicine is using is mostly a symptom-based approach. So you treat the symptom, you treat the specific disease, you have huge amount of various specialties, you know, and even every year, you know, they create new subspecialties and stuff like that, and then the doctor is actually not treating the patient as a whole, the doctor ends up treating the disease. You know, so well, you can treat some particular disease and quite effectively, you know, and after that another disease will emerge and the patient will die from something else. Why? Because this part of the iceberg is not being addressed at all, yeah? And it's a definition of delusion if you have that unshakable belief that by repeating the same set of actions you will achieve a different result in spite of rational argument and in spite of science and common sense, you know. And that's what conventional medicine appears to me at this moment, yeah. So they just keep on approaching, you know, and treating this part of the iceberg and totally neglect what's going on there. So let's look what's actually going on under the iceberg. And yesterday I took the leaflet, you know, of the People Unlimited, and there was a quote from the Aubrey de Grey. And if you know that he has introduced such thing as 7 deadly things. Yeah, so it is about the same. These are the 7 deadly things, but in another publication it was called the 7 pillars of aging. And every factor, whether it's deranged metabolism, whether it's micromolecular damage, epigenetic changes, and inflammation, and so on, all these phenomena, they are the characteristics for the aging, but also they are the characteristics for the age-related diseases. And there's a very, very thin line between the aging and when the normal, healthy, graceful aging becomes abnormal or morbid aging, and when you actually become, when you develop age-related diseases, you know. So it's a very, very thin line about it. And so far we have understood that there are actually ways how we can influence all those 7 pillars of aging. And for example, if you will skip your meals once in a while, you know, because it's physiologically, we have to be hungry as an animal, because we are the only species, you know, which, apart from the domestic animals, of course, which are constantly well fed, you know, and we don't have to put much effort, you know, to find food and all. It sort of keeps us in a comfort zone, you know, but it has its own side effects, horrible side effects. So being hungry, skipping meals, high intensity training, it doesn't mean that you have to go jogging, you know, and exhaust yourself and kill your knee joint and your hip joint, you know, and then even worsen your osteoarthritis. It has to be a high intensity training. We're talking about 20 minutes, 30 minutes, and all, not more than that, high speed, heavy weights and stuff like that. And then there are some very effective and in the same time quite inexpensive ways, pharmacological ways, you know, how you can slow down aging and reverse the senescent cells. And the use of metformin, you know, which is nothing else, but it's not just a sugar-lowering drug, you know, it's the AMPK activator, you know, the adenosine monophosphate protein kinase system activator. So that's how actually it works and reduces our age on a cellular level. And the senolytic drugs like the quercetin, you know, it's very easy and very inexpensive thing to get. And the resveratrol, which is nothing else but the fuel for our mitochondria, which without it or without NAD, we cannot survive even 30 seconds, you know. So, and we know that if you compare the young individual and the old individual, say, the amount of the NAD is about 5%, you know, in some of the people, you know. And then, of course, if you learn and understand and manage to influence the p53 gene, you know, which is when it's impaired, you know, we start developing cancers and so on and so on. And then absolutely new things, which until this moment, if you take any article from conventional medicine or any textbook, you won't find a single word about it, like the SIRT1 gene, for example, and the sirtuins, you know, that's chemical substances which can actually reactivate this gene, you know, and the mTOR gene and things like that, you know. Nobody is paying much attention in conventional medicine to that, hopefully yet. Hopefully they will start paying more attention. But the researchers and scientists and all, they've found out that these are the core biological mechanisms which are absolutely universal all across the species. All cells, they live according to these particular laws. And if we learn how to, and we understand how to influence this, we can actually improve, our quality of life. But it turns out that it is not enough, because more than 100 years ago, if I'm not mistaken, in the year 1881, August Weismann, and he was the German cell biologist from Freiburg, so he said that death takes place because worn-out tissues cannot forever renew itself, and because the capacity to increase by means of cell division is not everlasting but finite. It means that those days he has already sort of rationalized cell therapy and the stem cell treatment. It was 19th century. They didn't know much about stem cells those days. They didn't even know much whether they didn't know whether they exist. They had a suspicion. Rationally, from a scientific point of view, scientists thought that, well, there have to be some kind of a mother cell, that can turn into all the cells, but it was not identified yet. But although what they managed to see is that the comparison of the healthy tissue and the unhealthy tissue is such that all organs, tissues in our body, they consist of cells and extracellular matrix. So when there is a degradation or the degeneration of any tissue, it means that there is either malfunction or premature death of the cells and the degradation of the extracellular matrix. And over these past 100 years, we have understood that these processes are not irreversible. And in science, it is called tissue remodeling. So if we can increase the number of normally well-functional cells in the tissue, and if we can rebuild the extracellular matrix, we can actually regenerate tissue anatomically and, of course, its function. And these are some of the principles on which the modern regenerative medicine is built on. And we are actually now having two major problems. The first problem is how to deal and tackle the problem with the 7 pillars of aging. And the problem number 2 is how to regenerate tissues which have already been damaged, which have already aged, and which have already been damaged by the disease. So, cell therapy and the stem cell therapy, stem cells is just one of the aspects of the cell therapy. It's pretty much synergistic in its effect with all other approaches that I mentioned before, like the quercetin and the metformin, and the acetoins and all. So they also work in the same way, tremendously synergetically, So, but before cell therapy, as any other treatment modality, is offered to the public and is used for people, for treatment and all, we have to make sure that it is a safe procedure, that it's a safe treatment modality, So it's a safety first. That's what I believe, and I believe that all honest scientists and doctors should believe in. And for that purpose, we have done a small clinical trial, and it was not done by ourselves. We have involved a third party, independent organization. It was done in Germany in our hospital in Edenkoben, and this clinical trial took more than a year. It's at least a year plus of the follow-up of each patient, and they've randomly selected patients from 22 countries. It was almost 200 patients, 186 patients. And they've analyzed the outcomes of their treatment, in terms of the safety and the efficacy. And the follow-up was done for quite some time, for a few years. And they have seen that the allergic reactions were the mild allergic reaction, just in a couple of patients, was actually the only adverse reaction or side effect, of the therapy, which was treated easily, and just disappeared within a couple of days. And a very high number of patients, about 98% of patients, they had clinical improvements. And the return of the patients, coming back for the treatment again, maybe after 1 year, 2 years, 3 years, it depends on the state of the health, is also very, very high. Up to 97% of patients actually are coming back again for this particular treatment. So since we know that it's safe enough, the second question that we have to answer is how exactly does it work? Yeah, and to understand how exactly it works, we have to understand what actually is happening wrong, what's going on wrong, and to what aspects of our well-being and our physiology the cell therapy is influencing. And to understand that, we have to understand the phenomenon of the senescent-associated secretory phenotype. So it's something, it's a biological phenomenon. Like all biological phenomena, it has its beneficial values. In a young age, it helps to grow the embryo, then to grow the young individual, and then it helps to regenerate your tissues when you have some trauma, injury, and so on and so on. It saves and protects you from cancer, and helps you to heal wounds and all. But after some time, when this accumulated secretory phenotype, these pro-inflammatory markers, the cytokines, the interleukins, when their amount, when the expression of these factors by the tissues really go overboard, that's when it becomes detrimental, and that's when all those beneficial mechanisms, they turn into those malevolent biological phenomena, and it causes the tissue degeneration and the chronic inflammation. And if you heard the term inflammaging, yeah? So the chronic, low-grade, chronic systemic inflammation associated with the senescence, continuous aging and all. Now scientists call it inflammaging, so you're aging and you are inflamed in the same time. And all those diseases, all those pathological processes, they actually end up with us having all those age-related disease, whether it's a metabolic syndrome, diabetes, obesity, and so on and so on, and dementia, and the list is huge. So stem cells, and as well as many forms of cell therapy, they also do influence all these 7 pillars of aging. Cell therapy does increase metabolism tremendously. Cell therapy does repair of the macromolecular damage. Cell therapy has also, it brings those epigenetic factors that corrects the global methylation levels and corrects the epigenetic status of the patient. I'm going to show you later how exactly it works. It also has a very strong anti-inflammatory effect, a systemic anti-inflammatory effect. And the patients who underwent cell therapy, one of the first experiences they go through is that they feel disappearing of pain. Okay? And no pain, disappearance of pain is the #1 sign of reduced inflammation, okay? Because inflammation is always associated with pain. And it increases the adaptation of the cell to the stress on the cellular level, and improves the proteostasis, and it also will help to produce our own stem cells. Yeah, it's not only stem cells that we get exogenous, it's the stem cells that can be reactivated in our body. Unfortunately, not all tissues and organs still have stem cells when we are adults. Some organs don't have that intrinsic regenerative capacity at all, like kidneys, for example. We lose it during our fetal development. From the moment when we are born, we have actually 0 kidney stem cells. We can't regenerate it. And such organs as brain, for example, if you heard of the term post-mitotic organ, it means that the organ which cannot regenerate itself anymore. So brain was considered to be one of such organs, that the organ which can't regenerate. And only recently, within the past few years, we have found out that there is a neuroplasticity, that we have brain cells, brain stem cells in our hippocampus, the precursor of the neurons and all. But the problem is that when you have at least a slight systemic inflammation, it immediately, or stress, or the presence, the high expression of the stress hormones, it shuts down your neurogenesis completely. That's why we cannot regenerate our brain. And the capacity to regenerate our heart, is even low. Also it's less than 0.4% per year. But stem cells, they can ignite and they can reactivate all these processes. In our group, in our clinical practice, we wanted to validate, how exactly, whether it really helps to reactivate the mitochondrial function. And we have done the clinical trial on that. And what we have found out that before the treatment, the mitochondrial function was quite depressed, and after the treatment, it was only 8 weeks, the 2 months post-therapy. And we were able to return it back almost practically to the subnormal range. And the same happened to the system of the antioxidant protection. It's before treatment, the reduced glutathione, and after treatment is much increased. And especially the superoxide dismutase and catalase, the changes in these parameters of the antioxidant system before and after treatment were really tremendous. Then we have done the epigenetic test. We have compared the actual biological age, or we've done the epigenetic test for the patients before the treatment and after the treatment. And it was 6 months after the treatment. And we have found out that majority of patients, except just maybe a few anecdotal cases, had a reduction of their biological age after treatment. And in the worst case, it was like about 5 years and up to 9, 10 years in the best case. On average, now it's about 6 to 8 years. That's how you can reverse your biological age with just one session of a properly done cell therapy. So at this point, I think we should discuss what are the options of cell therapy do we have. Type of the cell therapy product, and in short, let's call it stem cell, which is mostly used by majority of the practitioners and clinics and centers and hospitals all over the world, are these type of cells. They are called the MSC, so mesenchymal stromal cell. And this type of the stem cell is just one of the types of the stem cells, and there are a lot of different types of the stem cells, okay? Believe me, hundreds of them. There are hundreds of different types of the stem cells. Now, this is something new probably, right? For everyone here, because you just think stem cells, that's it, yeah? Well, no. It's just the beginning of the chapter. It's just the beginning of the new book, MSCs are the easiest to procure. The easiest type of cell that a medical practitioner or a patient, any individual, can get their hands on. You can get it from the bone marrow, you can get it from your fat tissue, the adipose-derived cells. You can get it from another individual. You can get it from the umbilical cord. You can get it from the amniotic fluid, placenta, and so on and so on. And it doesn't cost much. But the problem with MSCs is that MSCs biologically, they can only differentiate and create only 7 types of the cells. So if, for example, you want to regenerate the bone tissue or the cartilage or the muscle or your ligaments, for example, well, MSCs, hypothetically, they have the biological potential to do that, okay? But our body consists of at least 220 different types of cells. And all those cells, they're highly specialized and they're very, very much different from each other. And each of these cells has their own precursor stem cells. They're all progenitor cells. So if, for example, you have a patient with a chronic kidney disease and you want to regenerate kidney, you cannot regenerate it with the MSC because the MSC has got biologically impossible to convert or create the type of the cell that builds up kidney. If you have somebody with a Parkinson's disease, so you know that there's a substantia nigra, the putamen in the brain, it's particular type of the neurons, that so-called the dopaminergic neurons, and they're producing the dopamine, and the degradation and the degeneration of that particular tissue and the accumulation of all the alpha-synuclein, and things like that, that protein junk actually kills those cells. If you will treat that patient with MSCs, MSCs biologically cannot convert, they cannot turn into the neurons that will produce dopamine. If you have a patient with ischemic heart disease, the cardiomyopathy, and you treat with MSCs, the MSCs biologically cannot turn into the heart cell. They cannot turn into the liver cell, they cannot turn into the retinal cell, they can't biologically. So here we come to the understanding, to the notion that effective tissue regeneration is only possible with a highly specialized type of the stem cells. And those cells are here. They're called the progenitor or the precursor stem cells. The MSCs, they are still at this level. They're pluri or multipotent. But the cells which can actually, they're tissue-specific, organ-specific, and they have the capacity to regenerate tissues, they are here. And that's a biological fact. There is no other option. No matter who tells you what, it's just impossible. If you will scrutinize all the entire medical literature about MSCs, you will understand that when they talk about the cells turning into the cartilage, for example, and repair the cartilage, it's happening in vitro. They're talking about the experimental data, about the Petri dish. It happens in the lab. Even if you take undifferentiated MSCs and you will implant to the patient, it's about 99% of those cells, at least, will never ever survive and turn into the cell of the recipient. They will be consumed by the immune system. They will do the repair, okay? They will reduce the inflammation, the patient will be better, 100%. But they will not perform the tissue regeneration. So MSCs can solve one problem, the 7 pillars of aging, but they cannot regenerate tissue. So what can regenerate tissue are the progenitor or the precursor stem cells. And that's how they look like. That's the neurons, the precursor neurons. That's how they look with the blue stain. It's after culturing in the lab. And that's how the pancreatic cells look like. You know, in the pancreas, it has different types of cells. You know, some of the cells, they produce insulin, some produce glucagon, you know, some produce exocrine, digestive enzymes. Every cell is a highly specialized cell. So we have the ability to culture, artificially create and grow those cells like babies, you know, literally, in a Petri dish. And can expand their volume. You know, you can have tens, hundreds of millions. You can have billions of those cells. And then you can put them in vials and you can have hundreds of vials, you know. It's unlimited, actually. You know, it's like People Unlimited, and the capacity, the potential of regenerative medicine and science and the cell biology is also sort of unlimited. You know, we can create any types of the cells. We can culture artificially any type of the cells. That's how the pancreatic cells look like with a mitotracker stain. And then we can culture cells from different species, and we can create a genetically modified cells. You know, we can create and use the so-called knocked out gene animal, you know, so that when you transplant cells which are taken from one individual to another individual, the main thing that you're always worried whether it will cause any immunological response and things like that. So the science now is at that level that with the genetic modification we can actually even create cells which are precursor cells in a fetal state that will not cause any much of an immune response or immune rejection from the recipient. You know, that's a great thing. So let's see how it works. So for example, we have a patient with a chronic liver disease, and from the point of view of regenerative medicine and the cell biologist, the approach to the triage and to the choice what sort of treatment approach or treatment strategy you use for this patient is absolutely the same as in conventional medicine. The staging system, or for example the model of the end-stage liver disease, which the regenerative medicine doctor use and the liver surgeon or the hepatologist use, are absolutely the same. The main difference here is that from the point of view of conventional medicine, they would rather wait and observe and try to do something, some symptomatic treatment, but they cannot stop the progression of the disease. And when the disease hits the end stage, you are only left with one particular option, which is the whole organ transplant. Yeah? From the point of view of regenerative medicine, we don't do it. We do not wait until the patient suffers for, I don't know, 20 years, 30 years, then develops liver cirrhosis and then goes for the liver transplant. And then before that, he waits in a long queue, you know, to get the donor, and then you get the donor, and then you don't know whether you survive or not. And then even if you survive, you don't know whether you're going to do well, whether your graft, the liver, will do well or not. Yeah? And then even if it does well, the rest of your life, another 20, 30 years, you have to be on immunosuppressive drugs every day. Yeah? Because if you skip that, your immune system will just kill that. So we believe that it's not really the optimal way. Yeah? And instead of waiting, for those 20, 30, 40 years, and then transplant the whole organ, we just do the hepatocyte transplantation. In a much, much earlier stage of the disease, we transplant the cells of the hepatocytes, cells of the liver, the hepatocytes, which will constantly do the repair. And we practically do not see patients who will reach the end stage of the disease. And on even those patients which have already developed some some level of liver failure, we can actually reverse that. And we have found out that those cells, the precursor liver cells, after they're transplanted, they start performing their function. Creating the albumin and synthesizing proteins and all, everything that liver has to do very, very fast within the first 2 days. 48 hours after transplantation, it is possible to detect the albumin which is produced by those cells. And then there are multiple routes of implantation, and most importantly, you don't have to wait for a donor, because the cells are just produced in the lab, and the laboratories are working day and night. The culturing process, in the petri dish, with the culturing media, it's a non-stop and never-ending process. Okay, so basically, we are just proving what the Cynthia Kenyon said, that if we understand how to repair things indefinitely, we just keep on repairing them forever. Same goes to kidney. A few years ago, we have taken our data for about past 15 years, and we have analyzed it, and the data was on the patients with a CKD, the chronic kidney disease, and what we have found out that if you don't wait until stage 5, until the end stage renal failure, and start treating patients during the at least 3B or 3A stage, you can reverse them. The 3A stage, you can reverse with an efficacy of 78%. Out of 100, 78% of patients can be actually downstaged. If you do it slightly later in a 3B, well, the success rate is slightly less. With a stage 4, also is a slightly less. Until this moment, we are under the impression that the end-stage renal failure, stage 5, is absolutely irreversible. But last year and the beginning of this year, we had quite a number of about 4 or 5 cases already when we were able to even reverse the end-stage renal failure. One of the patients actually is an American citizen, who was traveling from USA. He went to Europe and he got the treatment. He was on dialysis. It wasn't fast. Yeah, it took about 4 months, but the patient was off hemodialysis, off the regular HD, and the end-stage renal failure was reversed to the 3B. We started with the GFR, glomerular filtration rate. It's a biological marker, for the CKD with about 9, 11, and now he's 39, 40, 41. It's about 4 months. And doing better. Better and better and better. That's the most important thing. Same goes to heart. Once the patient survives acute myocardial infarction, he automatically shifts to the group of patients with a myocardiopathy. And that is a horrible disease. If you don't treat it properly, and it's practically incurable, yeah, from the point of view of conventional medicine. You can only cure that with a cardiac transplant. Yeah? You can only remove the heart and put another engine, for the patient. And otherwise, it's absolutely incurable disease. If you don't address that properly, within 5 years, the survival rate is about 50%. Okay? And it's a very, very stubborn organ. The ability of the heart to replace its cells. The ability of the heart to replace its cells, and to regenerate itself. In any individual who is older than about 20, 25 years old, is about 0.4, 0.5% per year. Yeah? It's extremely low. It means that it's just practically impossible to regenerate heart by itself. And even if you will And even if you use MSCs, for example, which are quite often used by the interventional cardiologists, and directly infused or implanted into the cardiac myocyte, or infused, via the endovascular approach, the ability of the heart to retain those cells is also extremely low. It is quite high within the first 3 days after the acute event. But if it is already 28 days, just less than a month after acute MI, and you will do this treatment strategy, it's less than 5% of the cells will stay in the heart, rest will be washed out. And are we getting back? Yeah. Yep. Okay. And there was a study done, a very interesting study, which was a clinical trial, it was experimental medicine, it was done in Europe and Netherlands. And they have found out that even if you directly infuse MSCs into the heart, and that they were observing how the cells were actually washed out, within 3, 4, 7 minutes, extremely fast. So the only solution to the cardiac regeneration, again, is the highly specialized, specific precursor stem cells for the heart. So if you keep on reimplanting regularly those cells to the patient, you can actually get a cardiac repair. And I'm going to show you the actual data, the actual statistical data and the actual success rate. But there's one thing also, ladies and gentlemen, you all have to understand that there is no magical pill. It's not that you only use this particular method of treatment and then you can solve all your problems. No, it doesn't work that way. You have to understand the doctor, the practitioner who is doing that, he has to understand precisely what's going on wrong with this particular patient. Okay? Not just an understanding what's going on with all the patients with cardiomyopathy, for example. What's going wrong with this particular patient. Because in order for us to make sure that the cell therapy works well, in order for us to get the 100% outcome of the cell therapy, we actually have to prepare a patient for that. And for that reason, we have created our own flow, our own therapeutic paradigm. Diagnose, detox, repair, rejuvenate. When the rejuvenation, the cell therapy, is only the final part of it. Okay? And after that, of course, you maintain patient further, with other products like the organ-specific peptides and so on, which Dr. Mike will talk about it tomorrow. Yeah, so that's a forward scatter. That's how immediately during injection, 2 and 4 minutes post-injection, those cells are washed out. And the study that was done with precursor cardiomyocytes shows that within 3 months, patients have clinical improvement, and they are lasting for at least 2 years. And the ejection fraction, the EF, the ability of the heart to pump out blood, how effectively it's doing that, can be improved up to 20%. And that's more than enough for a decompensated patient who is about to die to survive. And it gives another few years of life, at least. And while during those years, you can look for other effective solutions, how to improve your health. And all of the patients were downstage, and out of the patients who are treated with the precursor stem cells, within 3 to 6 months, none of them was in a functional class 4. Okay, all the patients, each one of them, were downstage. Neurodegenerative disorders, whether it's Alzheimer's or Parkinson's, any form of dementia, Especially, I took this article from just a few years old, from 2015. To quote this, that these undifferentiated fetal cells can support the functional recovery from Parkinsonian symptoms, survive, migrate to lesion brain areas up to 7 months. So don't look at the number 7 months and think that, well, that's not enough. I'm planning to live 700 years or forever, and you're talking about 7 months. No, we're talking about the survival of the cells in the patient's body, in the recipient's body. They survive for 7 months. Unlike MSCs, the MSCs die almost immediately. Precursor stem cells can survive. And not only they survive, they actually, they start a new generation, a new lineage of cells. These cells will replicate, okay? And these cells will do the tissue repair. And these cells will influence neighboring cells and stimulate their recovery and repair as well. It's called paracrine effect. It's done via the signaling, cell-to-cell signaling. And if, say, 15 years ago, in the early 2000s, the efficacy rate was not high. They were talking only about 30%. Now we're talking about 3/4 of the patients with Huntington disease and the Parkinson's who actually give good positive response after the cell therapy, 70–75%. It's very, very difficult to do clinical trials, especially in those settings and according to those requirements which are given by the governments and authorities in regenerative medicine and cell therapy. Very difficult. First of all, because in regenerative medicine, we have to understand that every patient is different. Every individual is different. Secondly, it is not really fair to patient, and it's quite immoral to this group of patients to use placebo-based trials. You know, it's like giving the false hope. You know, that's what we talked yesterday. Nobody wants to be in a control group. You know, and especially with such, it's a novice strategy, and it's a quite an expensive treatment for some people. You know, and but luckily, some of the clinical trials which were done in the past, they gave us some very valuable data. And this particular trial was one of the first clinical trials. There were 12 patients who went through the patients with the Parkinson's disease, who went through the xenogenic cell transplantation. And 7 months after that, one of the patients, he has passed away, unfortunately, because of a totally different reason. He had a pulmonary embolism. But because he was recruited, he was a subject for the clinical trial, he underwent autopsy. Yeah? And when his brain was examined, they have found out that 8 months after that, after the treatment, the cells that were transplanted to the patient, they were identified in the patient's brain. And they've also identified that those cells created a cell-to-cell communication with the neighboring cells. So it's different DNA, yeah? But still, it's the same type of the cells. And there are much more similarities between all the individuals and all the living beings, rather than there are differences. Yeah? And the microenvironment of the recipient, your own environment, will dictate, will tell those cells how exactly they should finally differentiate and how exactly they should function. Yeah? So, and those cells were able, and that's a proof here, those cells were able to create a communication with neighboring cells. And the patient had very good clinical outcomes in terms of the Parkinsonian symptoms. And those cells were able to produce dopamine. It means that you actually can cure the disease. You can off the patient from the regular medications. And it's possible. As another case that I'd like to present to you, and this gentleman, he was treated quite some time ago, 10 years ago. He was a very nice, very pleasant person, and he was the ex-High Commissioner, retired High Commissioner of Police from Perth, you know, from Australia, who has been quite old, and he presented to us in age of 82 years old, with a horrible Alzheimer's. You know, it means that when a person leaves home, most of the time he cannot get back, you know, because he just doesn't remember where he is. You know, and he had his heart problems, you know, and emotionally it was very difficult to live with him, you know, and we have some, you know, comments and the feedback from his primary physician who has referred him to us, and from his wife and all. And that patient, he underwent cell therapy treatment. He flew all the way from Australia to Malaysia. It was in the year 2009, and he got treatment with stem cells, and after that he had quite a nice recovery, and the guy actually he found his second life. You know, he has restored his youth. And these are the pictures from 2013, 3-4 years after a treatment with stem cells. A patient who had a horrible Alzheimer's disease. And here he's in the age of 85, 86 years old on these photos. You know what he started doing? A person who could not remember where he lives after he leaves his home, you know, start traveling all over the world. And he went to China, and he was sending us photographs from all his travels all over the world as a testimonial. And he was even on the newspaper in Australia. His name was Eric Brown, enjoying working in the garden after stem cell treatment in Kuala Lumpur. Old Eric flourishes on stem cells. Okay, that's what the precursor stem cells can do when they're used properly. And the list of the disorders that can be treated is endless. You know, if somebody, we talked yesterday about the hip degeneration. You know, instead of waiting for the hip replacement or the total knee replacement, you can actually start the treatment much earlier. Cheaper, less morbidity, you don't have to go through that rehabilitation period. You are practically doing much better 1 day after cell therapy. And that's only the beginning. Because unlike a pure pharmaceutical approach, cell therapy, it's the biological treatment. It means that it doesn't get off immediately, say after 48 hours or 28 hours, like the pharmaceuticals do. It triggers a reparative process. It means that after 2 days, it's going to be better than after 1 day. After 1 week, you're going to be even better. After 1 month, you're going to be even better. Of course, this process is not endless. Unfortunately, the disease and the aging will come back again, will try to take over, but we know how to tackle it already, right? And we can treat a lot of things, you know, even sleep disorders, even depression. And also, if you're interested, you know, we've published this article and you can find it online, and we have described what of the type of the sleep disorders can happen, you know, and how you can actually treat that even without medications, you know, just by the means of the cell therapy. So in a conclusion, I'd like to, it's like a take-home message. The first thing is that it's very important before an individual is doing something to their health, and before the practitioner is doing something to the individual, there has to be a very profound understanding of the pathological processes, any biological processes going on in that body. And for that matter, we need to pay a lot of attention to biological markers. And we are discovering more and more and more biological markers of aging. And such things as the very profound hormonal profile, including the DHA levels and all the stress hormones and all, the ferritin level, homocysteine, IGF, epigenetic tests, genetic tests and all. If that is done properly, definitely the patient, the individual will benefit in the end, yeah? Because I believe that every individual has rights to know what's going on wrong in their body, as well as in their mind, in their spirit, you know, and then try to treat that and improve that by some means. The second thing, we all have to understand that there are no minor things. You can't neglect it. If you think that if I will keep on eating unhealthy food, you know, or eat whatever carbohydrates, cakes, and stuff like that before going to bed, but I will still go to gym and I will take supplements and I will probably do cell therapy and all. No. Unfortunately, it doesn't work like that. There are no minor things, you know. You do 99% perfectly and you screw up in 1%, you will ruin all 99%, you will ruin all the efforts that you have put. Okay, so it's very important for everyone to understand it. And another thing that we all have to understand, that there's no magic pill, there's no panacea, there's no one treatment that will solve all of your problems, absolutely. Even the stem cells, there's still some uncertainty about the stem cells. But what we must do, all of us, we have to reduce that uncertainty about the stem cells, about the regenerative medicine as a whole. And the only way how to do that is via the clinical trials, more research, but most importantly, via the experience. That's all, ladies and gentlemen, that I have for now. Thank you very much. If you have any questions,
yeah, we
absolutely.
can do Q&A now. All right.
Thank you very much.
Thank you.
That was terrific. Two quick questions. One, you may have said this, but I didn't hear. What's the source of the precursor cells, stem cells?
Well, the source can be different. It can be procured from any individual, or, but you see, in the case of precursor stem cells, it has to be a fetal cell. So you cannot procure and you cannot have a human fetal stem cell because it's illegal and it's immoral and all.
Fetal.
But fetal, yeah, in the fetal
okay.
stage. But in a lab condition, we can create the same type of the cells from another species. And that's the lab animals which are used for that. And it's not a regular animal. These are animals which are genetically modified or with the knockout genes. The animals from the so-called the closed colony are specific pathogen-free. So you have the whole entire list of the viruses, bacteria, and prions and all which are not there, which 100% are excluded from that particular tissue. So literally, it's like growing an artificial tissue in the lab in a petri dish.
So, but it's another animal species.
Yes, it's another species.
Like for Parkinson, what kind of animal species?
Well, it
would
depends. Different countries are using, and different groups, different research centers are using different animals. You know, there's so many of the porcine origin or the bovine origin, but we don't deal with these two particular animals because, you know, in the world there's a huge community. There's a Jewish community, the Muslims, you know, and there's a Hindu, the Buddhists, and all, which have specific cultural restrictions.
Sure,
you know, so we just make sure that in all the 30 over years existence and our practice, you know, of our company, we don't deal with those animals. So in Germany, it was since many, many years, they use the sheep as the animal. It's quite well, and you can get the SPF animal and the rabbit, as a lab animal.
Great. And the second
just to complement a bit, Dr. Mike knows the exact number. How many how many drugs, how many medications are of the animal origin? It's hundreds or thousands, you know, in the world. And sometimes we don't even know.
Now, I have been spending 35 years of my life together with my wife, I'm 58 today, on stem cell research, predominantly in the Soviet Unions, in the old days, and Germany and Switzerland, and most part of Europe. I learned from all the masters of the world. Now, basically, you have to understand, there's a lot of confusion with the stem cells, which I'll explain tomorrow, okay, in my lecture. But one thing you have to understand, in the human body, you have 37.4 trillions of live cells. And out of these live cells, we have the super cells, we call it the parent cells or the mother cells. Those are the stem cells. And the stem cells will go down as you age. Okay, by the age of 60, you only have 5% left of your stem cells. Okay, now coming back to why we are talking about treating diseases, different diseases. Example for the brain. The brain itself has one organ, has 67 different types of brain cells. So we are talking about treating Parkinson patient, like Dr. D was mentioning. You need the substantia nigra. And we need 60 fetuses to make 5 ml of substantia nigra for a Parkinson patient. And for Parkinson patient, probably you need a double dose. There'll be 120 fetuses. We obviously cannot get this from the human being, right? But in the old days, in the early 80s, when I was a student with the Soviets, they used to get it from the human fetuses, true enough. But today's world, it is impossible. And as a Roman Catholic myself, I basically would not do that on human. But today, in today's world, there are still certain countries, you'll be surprised who are doing on the embryo and from the fetus. It's obviously illegal, all right? So we have to understand, after the 90s, new technology set in. We have to find a replacement. We can't do it human, obviously. When my wife and I took over the technology, we moved to Europe from the Soviets. We start to find substitutes, and we found out that one of the best animals was the rabbit. Because rabbits are retrovirus-free. We are talking about rabbits which are laboratory rabbits. They are very different. Now, all the top university of USA, all the medical university of USA, be it MIT or Harvard or Cambridge, they are buying from the laboratory rabbits from one of the suppliers in USA, okay? Now, Charles River is one of the top supplier in USA supplying laboratory rabbits. These are SPF rabbits. Of course, we also have sheep SPF coming from US too. You'll be surprised. The sheep and rabbits of our source are coming from US and going back to Europe. Okay, because we need the certification. We need the FDA certification. We need the documentation. Now, these rabbits are free from viruses. We are calling them specific pathogen-free animals. This is the future of animals, resources-based therapies. Now, look at insulin. You know, insulin is from the cow. And you have been using it all along, okay? A drug called cerebral lysine for pigs coming from pig's brain for the treatment of Alzheimer's disease, costing a fraction of the cost. Sold for less than $100 US. I mean, not in US, in Europe. It's found in most of the pharmacy of the world. Approved for the last 40 years. It was never approved in USA. You see the point there? All right? So I have to say, we are telling all the physicians and all the patients, we have to be very open in medicine. As long as it helps the patient, it won't harm the patient. That's what we want. Right? The important thing is there's a result and there's a potency, but no harmness at all, no side effects. So this is what we're doing. So basically, there are more than 10,000 products from animal origin, even approved by FDA USA. So don't ever think that there's no animal between us. Even in stem cells research, even in the lab today, when they are doing the stem cells on human mesenchymal cells, the feeder cells, the medium used are mostly from the mouse. They call it the bovine serum or the mouse serum. So he's using animal research, but the feeder itself, the tissue culture itself, is coming from
another
an animal. Right. And man is a human. I mean, we are animal. We are the most intelligent animal. And now coming back to the other question, you'll be wondering, why must I use animal, blah, blah, blah. Now, in the fetal stage, cells of all animals, including human, sitting on top of the animal kingdom, they are alike. That means the 200 organs and tissue found in your body, you have 473 cells there, out of the 220 organs and tissue. In the fetal stage, irrespective is animal pigs to human or humans to cat, they are alike. That is only in the fetal stage. We are talking about cells of the organs. Please understand, we are talking about cell xenotransplantation. The word xenotransplantation, even in Wikipedia, can be confusing. Okay, it comprises cell transplantation and organ transplantation. In the case of organ transplantation, even from a brother to a brother or father to a son, it will never applies. They will have rejection forever. Okay, that is the reason why you have cell transplantation. And imagine in the hospital, in the process of saving lives in emergency, there's a lot of blood transfusion. You're getting a blood from another body and someone else. Is there any rejections? No. You see the point here? Okay, thank you.
And your second question, please.
Hi. Wow.
Yes, please.
Solve a lot of problem with me, like a lot of information I really crave. Beautiful. Thank you.
Nice to hear that.
And as immortal, I need to ask you that question. When you rejuvenate a person from his disease, are you giving him instruction for the rest of his style, living lifestyle? Because it can occur again in a few years, you know? So if he got that, he will come back in 6-7 years. So what's the point?
Yeah, ma'am, absolutely right. And not only recommendations of what to do after, but it is equally important what you do before that. And that's why, as I said, I'm absolutely against a walk-in patient to any clinic and getting a stem cell treatment just upon request. It's not supposed to be done like that. You have to investigate the patient first. Then you have to prepare the biological terrain. You know, you have to make sure that his organism, his body is capable, is able of accepting, receiving those cells and getting the maximum best effect, not only the mind, your physiology, you know, your systemic inflammation level, you know, everything has to be taken into detoxification as well. You know, if some people, they have, depends on where you live and what lifestyle you have. You may have a heavy metal toxicity. You know, we're not talking about the acute poisoning. We're talking about the chronic load, you know, that people get all over the years, you know, the whole life. You know, and if you will effectively, you know, will pick up all those things, will understand it, and you prepare patient, and then you do the cell therapy treatment, and then, of course, you have a counseling. You know, we have the dietitian, the nutritionist, you know, who will explain the patient, and they will create a customized sort of like a menu, you know, and all the dietary recommendations, what you're supposed to eat, what you're not supposed to, and when, and how much. And when you're supposed to take certain supplements, or microelements or trace elements and all, or some medications at what particular time. So that all is given as the complete life program. Yeah, you can say like that, life program. And after that, we have the follow-up. We have the standards of the follow-up. When you have to call the patient back, when you have to do some bloods, you don't have to do all the blood investigations after 1 or 2 months. There's few things you do after 1 month, few things after 2 months, after 4 months again. And then if patient requires an imaging study, I don't know, MRI or whatever, it has to be done. This is still a medicine, okay? That's what we advocate. That's why we have only the MDs, the people who are coming from a conventional medicine background, okay? Because still the approach, the diagnostic approach, and the guidelines and all, it has to be fulfilled. I sort of understand it's like sitting on the 2 chairs, yeah? But I told you that I don't like the word alternative medicine, and I call it actually a common sense medicine. Okay, that's the best thing, because regenerative medicine is based on the knowledge that a medical student gets within the first 2 years in the medical school. I just can't understand why a lot of practitioners do not actually practice that. Do they forget about it, or they've been re-educated or something, during their specialization and things like that? Why do they neglect that knowledge that they have obtained within the first year? Yeah, and that's the most important and fundamental knowledge about the biology, about how our body runs. Yeah, so you cannot neglect these things. Yeah, and the whole treatment program for every individual, personalized treatment program, yeah, have to be created, and it's A to Z, basically. It covers all aspects of patients' well-being. Thank you.
Does this kind of cell therapy apply to the spine and spinal injury?
Yes, of course. It depends. It depends on the nature of the disease. It can be some diseases are post-traumatic, some diseases are degenerative. Yeah, as long as in the core of disease is the death or the malfunction of the cells and the deterioration of the extracellular matrix. As long as it's there, you can actually repair that. Yeah, there are other diseases, there can be an infectious disease, there can be an autoimmune disease. So for those types of the diseases, the treatment approach might be slightly different. Like for cancer patients also, we don't do the stem cells for cancer patients, but we rather do the immunotherapy, which will allow to reduce the dose and the toxicity of the chemo, the radiotherapy and all. Yeah. And you increase the efficacy by double. That's another aspect of our clinical practice. We do that as well. So you have to be, I repeat myself, but you have to be extremely, extremely clear about every individual's state of health, And for that matter, we actually do quite a profound screening of every patient who is coming to us in terms of cancer as well. Okay, so we don't want to start treating a patient from a different disease, So sometimes it can be still undiagnosed cancer, any tumor somewhere, So we don't want to accept patients who are undiagnosed with cancer, So we do the screening as well, So there's a list of the procedures that are done before, and a huge list of procedures which are done after. I gotta tell you that we have some patients who've been coming since 1980s. There was one very lovely couple. There was one gentleman, they're in Germany, okay, and they were getting the treatment regular, not every year, just once in a while, but since 1988, okay, and the gentleman is extremely lucky. His wife was 25 years younger than him, okay, so the wife, when I met them last time, it was last year, the wife was 72 years old. Yeah, the guy was 97, and his wife 72, and they were getting treatment for 30 years. Yeah, 30 years. Definitely, they didn't look like 90s and 70s. Okay, it's a very lovely couple. I've seen them. They go for a walk. After the therapies and all that. It's nice forest around it, and they look at least 30 years younger than they are.
Practical question. You mentioned potential hip replacement. avoidance. I have some clients that are looking at possibly doing this in the future, and I'm wondering if you can practically, first question, I have two questions. First question, is there a stage of degradation that is not repairable? Number one. Number two, what would be the practical thing to do? I mean, where would they go? How long does it take? What does it cost? Can you talk a little bit about just practical information about how that would come together?
Yeah. Thanks. That's a very good question. Well, first of all, it's not only looking at the stage of the disease. I need to look at the patient's profile, because we need to make sure what are his chances for future, his or her. Yeah. For example, if it's at that stage that it's almost irreparable and the patient still has to go for the hip replacement, is patient really in that state of health that he can actually go through that surgery? Whether it's a general state of well-being, other diseases, or patient's BMI, the body weight, and so on and so on. So you have to take all of those things into consideration. You need to have a clear understanding what are the chances for improvement in this particular case, not only based on the stage of the disease, but entire condition, the state of the health of the patient. Is there a situation when nothing can be done? Well, unfortunately, there are such situations. And for that matter of fact, we have the scoring systems and all, like for liver as well, we have the predictive sort of is a score which can tell you how long the patient can survive, this individual can survive. If you're talking about some weeks or 2 months or 3 months, well, maybe too late, because for every treatment, it also takes time to work for that treatment, So if the predicted lifespan of the patient is less than the duration that the treatment will take, don't even start, Unfortunately, at this point, where the science is, hopefully it will be better. Regarding where to go and what to do, we can exchange the contact, or I think one of the last slides, had the email address on the website, where you can actually go to. And we have the team of people, they depending on which continent the reference is coming from, they will handle those references. And there will be something like that primary triage, of the patients. They will go through the questionnaire, they will take the available medical data from the patient's medical practitioner, from their family physician, or whoever is treating the patient. And then we have a medical panel inside our group. We have multiple clinics and hospitals. Some of them are in Europe, in Germany, some in Switzerland. There are some in Asia, even in Bangladesh, Malaysia, Thailand, Philippines, China, Mexico is coming very, very soon. Okay, so usually the flow is such that we get the inquiry, that incoming data, and then we're going to have a small discussion inside our medical panel. And it's the primary stage when we decide yes or no. Can we offer something or we can't? If we say yes, we can offer something, second thing we look into whether the available investigations are enough or not enough. If something is not enough, we do it. We always find a way how to do it, either where the patient lives or sometimes they have to go somewhere else, because maybe it's not possible to do that with that method of investigation there. And after that is basically the final, we call it qualification, where the patient is qualified or not for treatment. And if the patient is qualified, we give the entire treatment plan. And that treatment plan will not be just, okay, you will get these cells today. No, we're going to tell you, this is the time when probably we're going to do the cell therapy for you, some implantation, but we have to do this and that before that. And after that, this will be your program. So that's the way how it works. Regarding the treatment cost, well, first of all, I would not be the best person to talk about the financial aspect of it. And secondly, it actually varies. It depends on what sort of products you have to use, because you have to understand that the precursor stem cells, they have one cost, and they're quite one of the most expensive. But then there are cheaper options, which are the frozen, cryogenically preserved cells, okay? And then there are cell extracts, or the peptides, the organ or tissue-specific peptides. They also have efficacy. Sometimes, and quite often, we have patients who do not require probably the precursor stem cells yet. You can solve the problem with, you don't have to go for the heavy artillery, you know? You can solve the problem with other methods, you know, with organ-specific peptides, which we also manufacture, you know, in our group of company, you know. So there are options, you know, a lot of options and a lot of possibilities. Thank you.
Okay, we got a last question is going to be Jim.
Wow, what a tremendously comprehensive presentation. Thank you.
Thank you.
Really
Thank you.
good, really
Thank you
good.
to everyone. Thank you.
So, yeah, my question is that, as you know, the skin is the largest organ of the body. Is there any work being done with stem cells to rejuvenate the skin at all that you have or know of?
Absolutely, yes, yes, yes. And it's not only the largest organ in our body, it's something like, it's like a business card, you know?
Yeah,
it's
yeah,
something
exactly.
that people start judging you
Yes.
based on how you look, you know, and
Yeah.
the whole impression and all. And lucky for us, this is one organ that has quite a good regenerative potential.
Yeah.
You know, so we have created certain formulations which are from the cell therapy domain and even not from the cell therapy domain. We have created a specific infusion which has 29 components, if I'm not mistaken. We call it TSRP, stands for the Total Skin Rejuvenation and Repair Program. You know, so it's a type of the IV infusion that carries all the necessary nutrients and also the combination of the peptides and all that will actually increase the cell turnover in the skin. And also we have specific formulations of the extracts, cell extracts, which are extracted from the dermal skin cells, from the placental cells, from the mesenchymal cells, and we create this formulation, like 5 components in one, you know, and that is specially made for the aesthetic application, for mesotherapy. It's just intradermal, not deeper than 4 millimeter injection, absolutely not painful. You can even do it with a mesogun. And you do it, say, once in 7-10 days, depending on the patient, how bad the changes are. It depends how many sessions they will need. And after that, they can probably come after 1 year, you know, something like that, to get another couple of sessions done, and that's it.
So you've had some pretty good success at rejuvenating the skin in that one, it sounds like, yeah.
We have an aesthetic department. Okay, we have aesthetic doctors, we have aesthetic dermatologists, whose mostly the job is just to do that. Because
that's one area that you didn't touch on completely, was the regenerative
Yes.
end of things. But
Yes.
of course, you did a lot of the talk on the, restoring organs, which is fantastic, of course. But I've
It's
heard
done
too,
in
you
the
got
same
a
time.
really good regenerative program.
yeah, it's done in the same
For the
time
skin and for the whole body, a whole body
as the part
regenerative.
of the regenerative program.
Right.
75% of patients worldwide present to us, and I believe to others regenerative medicine centers, without a specific life-threatening disease. The 75% of people who are coming to us for treatment are just the people who don't want to suffer the second half of their life spending money on insurance or medical treatment and being absolutely debilitated, you know, and then bedridden, you know, and being a burden for the community, for the society, for the family, and most importantly, for themselves. Okay? The people don't want to be a burden for themselves. So they come to us with only one demand. Just help us to keep the things going. We don't want to age.
Absolutely.
We don't want to fall ill. And in almost 100% out of those patients, when you actually investigate them, you find out that it's like, yeah, we're going to also include some of the diabetic protocol, you know, for your treatment. And then the patient tells you, but my family physician said that I'm not diabetic yet. They told me that I'm pre-diabetic, that I have another, 2 years, 5 years. And my argument is always, but why do you want to wait, you know, until you become diabetic? You can actually start doing something now. And you will never be obese, you will
There you
never
go.
be diabetic, you will never have the metabolic syndrome. But you already have the biomarkers which tell us that you are pre-diabetic, and so on and so on.
Excellent, yeah. So then I understand you have approximately 17 clinics throughout Asia and Europe, is that correct?
21.
In Mexico?
21,
Oh,
yeah.
21 now. Oh gosh, you guys move. Okay.
Because some are
Yeah.
fully owned by us, some are in JV, and some that we franchise.
I think we all want one here, am I correct, you guys? Or-
That's just the right time.
After hearing all this, but anyway, these clinics, do they all then on that level offer this regenerative medicine too then, or are there specific clinics right now for that?
Well, it depends. We always try that. No, there's few things few things are compulsory. First of all, the staff, the medical personnel have to be trained equally on the same level of the medical proficiency and knowledge in cell therapy and everything in all the clinics, irrelevant which country they're in, what medical system they practice under. We educate doctors and nurses. That's one thing. The second thing, types of the products, that the quality of the products are absolutely the same in all centers. However, each center is in a different country, and every country comes with its governmental and all the FDA and the authority regulations, so we have to follow those regulations. So there are certain treatments, certain therapies which say cannot be used in this country, so we don't install it there.
Gotcha.
But we try to find an alternative solution for the patient.
Great.
Always. So if you can't do it here, well, where I'm gonna do it, So we always recommend that, okay, then you can do it here. Or maybe you can't do this therapy in this country, but we have a good alternative therapy for this, so we're gonna promote this type of treatment here. So that's how it works.
Okay, beautiful. Thank you so much.
Thank you.